Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a case of a clear cell carcinoma of the cervix. So this is a case of a 40-year-old female patient who started to complain of postcoital bleeding for about 18 months. So she underwent cervical biopsy followed by hysterectomy. And this is the low power magnification of the hysterectomy specimen. There was a large cervical mass 4 centimeter in maximum dimension, and as you can see here from the low power magnification, it's a sort of an adenocarcinoma. And on higher power magnification, while we zoom in into the glands, as you can see here, the glands are composed or lined by cells with pleomorphic, highly pleomorphic nuclei and prominent nucleoli and clear cytoplasm. And more here as well, we can see the glandular formation with the clear cytoplasm, the round nuclei, and the very prominent acidophilic nucleolus growing in a desmoplastic stroma. Importantly, some of the glands which were kind of dilated show this very characteristic hoop nailing pattern, which is typical of a clear cell carcinoma, and some of the detached cells again showing this hoop nailing pattern, very characteristic with this large pleomorphic nucleus and the prominent nucleolus, and again here showing the same really voluminous cytoplasm, large nucleus, prominent nucleolus, and then this hoop nailing, very characteristic. And remember that the cytoplasm mostly is clear. Sometimes it can be acidophilic, but most often is clear cytoplasm. And P16 immunostain is strongly positive in the tumor cell cytoplasm as well as the nucleus. Now this would bring into the differential diagnosis HPV-associated carcinoma. However, we'll see now with the rest of the immunostains. So remember that P16 immunohistochemistry was positive. HPV-16, however, these are the glands, this is the stroma, is completely negative. And sometimes actually the counter stain, the hematoxylin only stain, if you look into the hematoxylin only stain, the negative control in a way, you can really depict beautifully the characteristic features of the nucleus and the prominent nucleolus. So sometimes really I resolve to the hematoxylin only stain to really identify the characteristic features of the nucleus and the prominent nucleolus. Now Napsin-A, because of the morphology, clear cell carcinoma was in the differential diagnosis, and Napsin-A showed this beautiful, strong, granular positivity in the cytoplasm of the glands, highlighting the malignant cells, and AMACR as well showed this granular positivity in the tumor cells. So both of these supports the diagnosis that this is a clear cell carcinoma. What about P16? P16 is known to be positive in a clear cell carcinoma of the cervix despite its lack of association with HPV infection. So within the context of a clear cell carcinoma of the cervix, P16 is expected to be positive, but this is not equal to HPV infection. Now, the CEA was negative in the gland, as was Vimentin, which was negative, completely negative in the glands. And again, ER completely negative in the tumor cell in nuclei in the presence of background of internal positive control. So the diagnosis of this case was cervical adenocarcinoma, HPV-independent clear cell type. Now remember that this type of carcinoma can occur in association with intra-uterine use of diethylstilbestrol. However, usually those cases associated with the diethylstilbestrol use occurs usually in younger age group with a mean age of 19 years of age, while the HPV-independent clear cell carcinoma usually occurs in older age groups, slightly older than this patient, but usually not in the early, in the teens or early 20s. And also remember that the clear cell carcinoma of the cervix, despite its lack of association with HPV infection, it is still positive for P16 immunohistochemistry. So this should not make you render the diagnosis of HPV-associated cervical adenocarcinoma because of the difference in the risk factors and because of the difference in the outcome and the response to chemotherapy in those two different entities. I hope you find this tip useful in your daily practice. Thank you.